Mary, thank you once again for all your great tax-saving tips on our business. You really saved us a great deal of money this year. You're welcome, Jan. Your consulting business has done extremely well this year. There was one more thing we need to speak about this year. Last year you never had any health plan to cover routine healthcare costs for you and your 2 employees. All your healthcare costs were out-of-pocket expenses, and we ended up running yours through your personal taxes as a medical expense. As I mentioned last year, when we run these expenses through your personal taxes, you get hardly anything back. I estimate you recovered no more than 10% of all your healthcare expenses. I assume you still do not have a health plan for your business. Yes, thanks for bringing this up, Mary. I almost forgot. My assistant Jill has started doing some research on this. Jill contacted a few small businesses we know to see what they are doing about health plans. A couple of them had the traditional monthly health plans from providers. I know was from Blue Cross. They were not very happy with these plans. They were not even sure if they were breaking even on their monthly fees. Plus, they still had lots of out-of-pocket healthcare expenses left over. Jen, what you found out so far doesn't surprise me. Here is the reality for small businesses like yours. On average, for every $100 you pay each month, you get back about $70 in paid benefits. Yikes! That is awful, Mary. So what are we supposed to do? Well, Jen, the good news is there are other options. There is one type of solution out there that works extremely well for small businesses like yours. Canada Revenue Agency allows incorporated companies, like yours, to pull out money out from your business, tax-free, to cover out-of-pocket healthcare expenses for owners, employees and dependents. To do this, you have to set up a health spending account. Some people in the industry refer to this type of plan as a private health services plan. Jan, the bottom line is that it is far more cost-effective to use a health spending account to cover your business's routine healthcare expenses. Health spending accounts plans have no percentage limits imposed. 100% is covered. These plans also cover a much wider range of non-traditional healthcare services. Mary, that sounds very good. How do these plans work? Do I pay first and get reimbursed? That's right, Jen. It works like this. First, you, as an owner, your employee pays the healthcare provider, and you then submit a claim to the health spending account provider. Second, your company is then directed to submit a check to pay for the total cost of the expense. Lastly, the health spending account provider adjudicates the claim based on rules set out by Canada's Revenue Agency. The employee, or owner-employee, in your case, is then reimbursed personally for that out-of-pocket health expense. Makes sense so far. But how much do these plans cost? Can we afford it, Jen? That's the great thing about these plans. There are no monthly fees, and your company sets the budget for healthcare expenses every year. It's really not that much different than the way you set your budget for office expenses every year. You would set up a healthcare budget for you and your 2 employees. Normally, as an executive, you would set yourself up with a higher annual limit, and your employees may have different limits, depending on their title, responsibilities, length of service, etc. Okay, got it. Mary, it kind of makes you think, why doesn't every small business have a health spending account? It really sounds like a no-brainer compared to the choices of having no plan, or taking out a traditional health insurance plan. You hit the nail on the head, Jan. Every small business should have a health spending account. They are now becoming as popular as a bank account for small businesses. This is precisely why we are recommending them to all our business clients. Are there a lot of health spending account providers out there? How do we choose? Yes, Jan. Our clear choice for health spending accounts is Pre-Tax Health. We have reviewed a number of providers, and in our view, Pre-Tax Health is the number one choice. Mary, what are the key reasons why you would recommend Pre-Tax Health? Jen, there are a few reasons why Pre-Tax Health is the preferred choice for our clients. First, they have the only real-time online system we have come across, which makes it fast and convenient to submit and monitor claims. Second, they include a bunch of powerful claim tracking and expense management tools as part of their system. They are powerful and easy to use. Third, they are very flexible. You can pay each claim as you go, or pre-fund your account to make things a bit easier and to get reimbursed even faster. How does Pre-Tax Health compare to the others in terms of cost? Pre-Tax Health is very cost competitive. Their setup fee is lower than most of the others. They only charge a one-time setup of $99 to set up your company, no matter how many employees you have. The only other cost is a 10% admin fee for each claim that is processed. This is very reasonable considering their service is great, and they have proven to be fully compliant with Canada Revenue Agency rules. Okay, I'm sold. How do I sign up for Pre-Tax Health? That's the easiest part. You simply go to their website at www.pretaxhealth.com and sign up right there. Since this is your first health spending account, we can go back up to 2 years and claim a bunch of out-of-pocket expenses we haven't claimed before. Most of our clients set their end date for their health benefit year to correspond with their company's year-end. That's what I would recommend. Anyhow, let's take a few minutes now, go to the website and set you up. I have an appointment in 40 minutes. How long will this take? We can have you all set up in under 3 minutes, and when you get back to the office you will receive all your setup instructions via email. Great. How long before I can submit claims? I have a stack of receipts and I would like to start getting back some money. Jen, when you get back to the office today you will be able to start submitting claims. Fantastic. Let's do it.